Next, I want to recognize the gentleman from Connecticut, Mr. Courtney.
Thank you, Mr. Chairman, and thank you to all the witnesses for being here today. Mr. Mitchell, I want to again thank you also for correcting the record regarding, or just adjusting the record regarding the discovery of the COVID vaccine. Actually, just 3 weeks ago, the U.S. Patent Office awarded the NIH a patent on the spike protein technology, which Pfizer and Moderna used to basically come up with their iterations of a vaccine. Again, the taxpayer took a lot of the risk out of the research that went in. And again, as you point out, that actually preceded the outbreak of the virus. I think almost every other member on this subcommittee, with all the COVID relief bills that we voted on, going back to the original, even pre-CARES Act, billions were approved on a bipartisan basis, in which for all of us, I think should, feel good about in terms of, trying to accelerate and create the warp speed mechanism that, again, was a great success. And the companies who were involved in that, kudos to them. But, it is clear that the taxpayer and NIH were instrumental, even to the point of having legal ownership. And Mr. Chairman, I would ask that the patent notice be admitted to the record. Again, just to confirm the government and the taxpayers' role in terms of getting us to the vaccine.
Without objection.
Thank you. And Ms. Sokol, I speak a lot to the Connecticut Insurance Department. We have a regulated insurance market where rates are approved on both the individual market and the business market. And last year, the insurance commissioner reported that the share of premiums that employers pay for prescription drugs is now at about 23% of premium dollar. If you go back really even just a few years ago, that was at 15%. So, do you see that trend in employer-sponsored plans in terms of how much prescription drugs are driving the increase in premium?
Yes, we see that a lot. And not only increase in premiums, but really increases in the overall spending that patients make in their overall out-of-pocket costs as well. So
again, there are obviously a lot of other healthcare costs that go into the premium dollar, whether it's, hospital reimbursement, physician reimbursement. So again, it's really disproportionate in terms of, again, the trajectory that we're seeing right now, which really is why I think this bill, which sometimes when you talk about prescription drug costs, it's all sort of about Medicare. This bill is not just about Medicare. It's also about providing relief for employer-sponsored plans.
Absolutely. And a lot of what's driving these costs is these very high, very expensive drugs that really don't offer any additional value as compared to other alternatives that are in the market. But they're just increasing their prices, and that really unbeknownst to patients and often to physicians as well.
So again, as someone who was also a small employer at one time, I want to just sort of go back to this point about what the employer's sort of fiduciary responsibility, what his options are. Again, this bill does not mandate that an employer purchase a healthcare plan that has the government negotiated price, right? They still have an option to use market or PBMs or whatever to get their prescription drug coverage. Is that right?
They do have an option, and that option would bring really important transparency to this market, because even if a self-insured employer is hiring a PBM to negotiate on their behalf, oftentimes the employer does not even know exactly how much they're paying for drugs. There's an important lack of transparency there, and this bill would bring a lot of transparency back for employers to know what's best for them.
And transparency is really what is essential for market economics, isn't that correct?
It is crucial.
That's the irony of some of the rhetoric here, is that actually this bill actually provides a healthier marketplace, not a more restricted marketplace. Isn't that correct?
It is. And part of the lack of transparency is having so many intermediaries in our negotiations, and having a transparent benchmark will help employers to be able to even monitor the work of these intermediaries more effectively.
Well, thank you for your testimony. And Mr. Chairman, in the spirit of moving along, I yield back the balance of my time.
You get to go.